This video describes about uterine balloon therapy, an alternative to hysterectomy for women with menorrhagia or excessive menstrual bleeding, UBT procedure, benefits and where to go for this therapy. Uterine balloon therapy is a minor surgical procedure that offers an alternative to hysterectomy for women with menorrhagia. It destroys the lining of a woman's uterus using a balloon that is inserted through the vagina, then through the cervical opening. The balloon, once in place and properly positioned in the uterus, is then filled with a fluid and then heated. The heat undergoing the therapy then destroys the lining of the uterus. Uterine balloon therapy does not involve the removal of the uterus, in fact no incisions are involved. Uterine balloon therapy can be done in a day surgery setting, eliminating the need for an overnight hospital stay. Patients can be back to work within a day or two and do not require extensive restrictions to their activities. Many women are extremely pleased with the outcome of this therapy. Uterine balloon therapy or UBT essentially involves thermally destroying the endometrial lining of the uterus in 3 steps. The 3 steps involved in UBT procedure are discussed briefly along with pictures. Step 1. A balloon catheter is inserted vaginally, through the cervix, and into the uterus. Step 2. Once the balloon is inserted, it is then inflated with sterile fluid, so that it expands and fills the contours of the woman's uterus. The fluid inside the balloon is then heated and maintained at 87 degrees centigrade for 8 minutes, which scalds and permanently destroys the endometrial lining of the uterus. Step 3. Once the treatment cycle is complete, the balloon is then deflated and the catheter is removed back out of the uterus and vagina. All of this is done under general anesthesia. Almost all patients are discharged the same day after the UBT procedure. Most patients experience little to no pain, other than mild to moderate cramping during the first day, which is often managed by over-the-counter pain relievers. The lining of the uterus, endometrium, will gradually shed away through the vagina like a period over the following 2 to 3 weeks. Women who have been suffering from menorrhagia, or excessive menstrual bleeding due to benign causes, are the right candidates for UBT procedure. However, UBT is not a suitable therapy for women with submucous fibroids or patients with large and irregular uterine cavities. Uterine balloon therapy is not for patients who have not completed their family planning and intend to have children, as becoming pregnant after uterine balloon therapy can be life-threatening. The overall success rate for women that undergo UBT is around 80% and significantly reduces menstrual bleeding for these women. Dr. Seema Mehta, obstetrician and gynecologist from Vardhaman Maternity Home, Udaipur, Rajasthan, India, is specialized in this new and advanced technology called uterine balloon therapy, which offers an alternative to hysterectomy for women with excessive menstrual bleeding or menorrhagia.